कट ना जाए, बस यही है।
नहीं सर,
नहीं
डेली
तो
पे डाल दिया मैंने।
आपको क्यों चाहिए इंटरनेट?
वो यार एक हीरो वाला मुझे वो दिखाना है,
अच्छा।
यूट्यूब वाला ना।
सर ये इस पे आ जाएगी, फिर आप करिए।
चश्मा लगा रहा
वो रोबोटिक वाला दिखाना
हाँ
है?
यार।
वो मेरे पास वीडियो है हीरो का।
नहीं मेरे पास भी है, बट वो वैसे वीडियो।
हाँ हाँ।
अब वो कहाँ से उसको आप वो करोगे?
नहीं नहीं, वो तो अभी आपको मैं एयर ड्रॉप कर देता हूँ।
हैं? नहीं कैसे, कहाँ से दोगे?
6 मिनट मेरे पास तो है सर, ऑस्ट्रिया का।
हाँ नहीं, कहाँ से दोगे कैसे इसमें?
सर एयर
सर
ड्रॉप
अभी हो
कर
जाएगा
देंगे।
एड्रो, ला भी।
तो अलग से मैं वो करूँगा।
नहीं नहीं, उस
हो गया, छेड़ेगा तो अपने।
Copies in the left side.
Good start. Good evening, all. Respected Professor Vivek Lal, Director PGI MER, Professor R.K. Rathod, Dean Academics, Professor Sanjay Jain, Dean Research, former directors, former deans, former heads, Professor Naresh Panda, sir, former Dean of the PGI and former head, our ex-chief, the Department of Otolaryngology and Head and Neck Surgery, all senior faculty members, faculty colleagues, residents, students, and dear delegates. On behalf of the Department of Otolaryngology and Head and Neck Surgery, I extend a warm welcome to all on the occasion of the 16th Professor Mehra Oration today. Now I'd request Dr. Maryada to present a bouquet to Professor Lal. Anuradha ma'am to present a bouquet to Professor Rathod. Dr. Parul to present a bouquet to Professor Sanjay Jain, Dean Research. Dr. Sange to present a bouquet to Professor Naresh Panda, our orator for today. And Dr. Sukriti Mehra to present a bouquet to Ma'am Usha Mehra. Thank you so much. Just a brief about this oration. This oration is a prestigious oration which was started in the year 2008 in the fond memory of the founding father and the first head of otolaryngology at PGI, Professor Mehra. 15 such orations have been delivered by eminent ENT faculty and researchers from India and abroad. And today marks the 16th oration, and who better than Professor Naresh Panda to deliver it, who is one of the most well-known ENTs of the country and was a favorite of Professor Mehra. Sir, I welcome you as the orator for the 16th Professor Mehra oration. Now I invite Professor Vivek Lal, the Director of PGI, to address the August gathering.
Mrs. Mehra, Mrs. Chug, Professor Sharma, Professor Panda, Professor Ratho, Professor Sanjay Jain, Professor Madhu Khullar, and everyone else in this hall. It's time to remember one of the founding fathers of this great institute again. And these orations, they come and go. But I just always harp on one thing, that they were giants of yore. These founding fathers were giants of yore. When I joined this institute in 1987, I was a young and crisp president, always used to showing off, and one day, unfortunately, I bumped into Professor Mehra. He recognized me because I had a stetho around my neck, and he says, "Come here." So I went. He was coming out from his office on the 5th floor, The ENT office used to be on the 5th floor, B block at that time. All the offices, you know, adjacent to the lifts, whether it's B or C, I don't know, whatever you call it. So wrong time, wrong man, the result was wrong. He says, young man, you have a stetho around your neck, but you don't have a overall around your, around yourself. And I thought an overall would be, you're kind of impinging on my aura. He said, you have a vest on, but you must have the overall on that vest. And that is how I did my residency, did my DM also. It was a habit which I carried along with me. Summers, the overall was on, obviously, on warm coolants. The other way around. In summers, it was on a vest, in winters on warm. I just got used to it. My second interaction with him, which I have never forgotten, was when Professor Chopra told me to go and show him a patient. I don't know why Professor Chopra sent me. He thought he's probably not going to come back alive, so he sent me to him. So this patient had a 6th nerve palsy. I narrated this incident last year also, and I think the year was 1990 or 91. And I went to him and I said, sir, here's this patient who's got a 6th nerve palsy, young lady, 25, 26 years old. And we didn't have an MRI at that time in PGI. This is a CT scan, and a high resolution CT scan was normal. So I said, sir, this is idiopathic 6th nerve palsy. I don't know whether you're aware or not, Professor Y.N. Mehra had this habit of holding, when he knew you're wrong, he would hold you by the shoulder. So he showed me the eye movements. There was a 6th nerve palsy. He says, young man, the CT scan with the high resolution is wrong. Okay, it's normal. But what about your brain? This is a nasopharyngeal carcinoma. I want to do a biopsy. Anyway, it turned out to be a nasopharyngeal carcinoma as expected. He just casually asked me, how old are you in PGI? I said, sir, I'm 4 years old. I've just finished my MD and I've joined my DM in neurology. So he says, Professor Chopra is your boss? I said, yes. He says, like boss, like student, both of you know nothing. That was the kind of friendship. That was the kind of friendship that they had. That was the kind of friendship that they had. I'm just trying to make a point. And they were good friends. They fought like lions. When they fought, Friday morning statistical meeting was something we all dreaded, but they had a lower limit, and they fought with only one thing in mind: the welfare of residents and the welfare of patients and the welfare of PGI in mind, nothing else. They were innocent warriors. They were innocent warriors. This is the message I want to give to all of you. When I talk about these giants, they are the giants who actually converted this institute into an institution. Otherwise, this institute was, 1963 was an orphan institute. It was kind of, Pratap Singh Kero must have had some divine vision to make this institute in a jungle called Chandigarh. AIIMS was built in a roaring capital of the world called Delhi. The British had won the Second World War, and after London, the most powerful capital in the whole world was Delhi, and so AIIMS was born there. And PGI was born in a jungle. But now you look at the trajectory of PGI, look at the path of PGI vis-a-vis AIIMS. We are the only academic institution in India which transmits our academic sessions to the rest of the world. No other institution does it. It's all because of these founding fathers. It's all because of these giants, and giants invariably produce giants. So Professor Panda is one of them. Sir, thank you so much for agreeing to come here. Professor S.K. Sharma, thank you so much for being here. I just saw Professor Chawla walk in. Good afternoon, sir. Thank you so much. Each one of you learn from these giants. The concept of work-life balance didn't exist then. Life was work and work was life. Be very clear. Be very clear. When you're doing your residency, that is your motto. After that, you can go to Everest, whatever you want to do. But when you're doing your residency, that should be your motto. That should be your motto, because that is the driving force that will make you into a 4x4 wheel drive for you to do well in life. With that, once again, Professor Panda, thank you so much for being with us, and I welcome you all to this August oration. Thank you.
Thank you so much, sir, for these inspiring words. They will surely inspire us to move even further and take this institution to new heights. Now I invite Professor Jayamanti Bakshi, the head department of ENT, to speak a few words about the late Professor Y.N. Mehra.
Good evening, everyone. On behalf of the Department of Otolaryngology and Head Neck Surgery, PGI MER Chandigarh, I again welcome all of you for this oration. So it's my proud privilege to speak about Professor Y.N. Mehra, and I will introduce him briefly. He has a huge introduction and his CV is very vast, but I will be briefly telling about his career, his achievements, and what he has done for PGI and for the nation. Professor Y.N. Mehra, so we all pay a tribute to Professor Yogendranath Mehra. He was Doyen of Otolaryngology and visionary leader. So he was former Dean of PGI MER Chandigarh and former head Department of Otolaryngology and Head Neck Surgery at PGI MER Chandigarh. He was the founder of our ENT department at PGI MER in 1961. He was visionary in otolaryngology in India, and he was renowned disciplinarian, passionate about the field of ENT and a pioneering educator. His early life and education: he was born on 30th of September 1931, and he did his graduation from Medical College Amritsar in 1955. After that, he did fellowship in otolaryngology from Royal College of Surgeons of Canada, and then he did diplomat of American Board of Otolaryngology from USA. After that, he did his master's MSc in neurology and neurosurgery from McGill University in Canada in 1961. After that, he joined PGI MER and he established the Department of Otolaryngology and Head Neck Surgery in PGI in 1961. And he was visionary leader with disciplined approach. His pioneering work in otology and neurotology is remarkable, and he was passionate about otology and neurotology. He was first in the country to start neurotology lab in India, and he is known for his teaching, clinical skills, and surgical expertise. He had lot of interest in stapes surgery, and he is known for that all over India and abroad. He mentored many residents who hold senior positions worldwide. He was a great teacher and great mentor, and he is recognized for his teaching abilities. Many of his students hold senior academic positions globally. He was a passionate educator who shaped a generation of doctors. He has inventions and awards to his career. He invented the optokinetic stimulator in 1973, and this is a device for measurement of the nystagmus. And he was awarded Invention Award by the Government of India for this innovation. He was a true leader, and his leadership roles and contributions can be seen as he was president of Association of Otolaryngologists of India, and he was president of Neuroequilibriometric Society of India, and he was honorary consultant to the armed forces. Among his recognition and honors, he was honored with emeritus professorship by PGI MER for his outstanding services, and he is recognized as a thought leader in otolaryngology. In his personal life, he is survived by his wife, Mrs. Usha Mehra, ma'am, who is present with us today. I welcome you, ma'am. And their son, Mr. Vivek Mehra, and daughter, Miss Vandana Mehra, are settled in the USA. Professor Mehra has left a lasting legacy, and his impact on otolaryngology and medical education continues through his students. His contributions to medical science and leadership have left a lasting legacy. Today is the 16th Professor Y.N. Mehra oration, and 15 such orations have already been delivered by eminent national and international faculty. And today's oration will be delivered by no other than Professor Naresh Panda, former Dean and former Head of the Department of Otolaryngology at PGI MER. I welcome you, sir. The recent previous orators were Professor Arunalok Chakravarti, in 2022, and Professor I forgot his name, Ajit Nilkantan. He was Director General Armed Forces Medical Services in 2023. Thank you all.
Thank you, ma'am. Now I call upon Professor Satyavati, Head Unit 2, Department of ENT, to introduce the orator, Professor Naresh Panda, sir.
Good morning, everyone. I have the pleasant task of introducing today's orator, Professor Naresh K. Panda, sir, former Dean, former Head, Department of Otolaryngology, Head and Neck Surgery. Sir has more than 40 years of experience at different administrative committees of the Institute. He has provided effective leadership to the Department of Otolaryngology for more than 18 years, and due to his sincerity, dedication, and passion for the care of the needy. He has been a dynamic team leader and brought up an excellent academic department at PGI, a department having facilities like cochlear implantation, robotic surgery, sleep services, skull-based surgical facility, transoral laser microsurgery, and silendoscopy has recently been added, which is available in very few centers. He had been a meritorious student during his undergraduate time, and this stint continued through PG level and later in life. He has been a founder member of various national and international societies, and few of them included he'd been elected fellow of the International College of Surgeons, Chicago, life membership of Austrian Medical Society, Vienna, membership of New York Academy of Sciences, fellowship of Royal College of Surgeons of Edinburgh, and fellowship of National Academy of Medical Sciences. He has been nominated as a core member of the OSCE team by National Board of Examinations, New Delhi, for introducing OSCE in various specialties. Professor Panda delivered various orations at national and state level and was elected as a member of the Faculty of Surgical Trainers of the Royal College of Surgeons of Edinburgh, UK. He took over as the editor-in-chief of the Annals of Indian Academy of Otolaryngology, which is an official journal of the Indian Academy of Otolaryngology, Head and Neck Surgery. Professor Panda guided 30 master's theses and 7 PhD theses. He has more than 400 publications to his credit in various international and national journals and has written around 11 books. Professor Panda has various surgical innovations to his credit. He has formulated new treatment algorithms, modifications in surgical techniques, a new classification system for improving surgical outcomes. He has modified the posterior tympanotomy approach for facial nerve decompression, modified Bailey's incision in parotidectomy. He has described a novel periosteal flap in cochlear implantation, proposed a classification system for round window exposure during cochlear implantation. He has been equally brilliant in so many extracurricular activities and enthusiastically pursued them. We welcome Professor Panda, sir, the person who started this oration 16 years back. Welcome, sir.
Thank you, ma'am. Now I call upon Professor Panda, sir, to deliver the oration.
ठीक है
स्लाइड शो करना है यहाँ से होगा
Good afternoon. Professor Vivek Lal, Director PGI, Professor R.K. Rathod, Dean Academic, Professor Sanjay Jain, Dean Research, former directors, Professor S.K. Sharma, Professor Yogesh Chawla, my former colleagues, I can see Madam Suri, Dr. Suri, former Dean, academic, and other faculty members. It's actually a very emotional moment for me. And I'm grateful to the Department of Otolaryngology and the head of the department, Professor Jayamanti Bakshi, who has given me this opportunity to deliver this year's oration. Talking about Dr. Mehra, I mean, the words are too many, the thoughts are many, and I would just sum up that he was a remarkable person, a great human being, passionate clinician, and Dr. Lal talked about his clinical acumen, and I also remember one of the instances. I was a senior resident, third year, about to finish, and we were in the private ward rounds, and there was a patient with left supraclavicular lymph node. And as senior resident, we were expected to present the rounds. And I said, sir, this patient came with this, we did this. And so he said, what do you think? I said, sir, we'll have to rule out other malignancies, particularly lung and other things. So he entered and started sniffing like this. I was wondering, what is he sniffing for? And then he said, I think it's tuberculosis, Naresh. So, so I was said, I mean, this is a diagnosis out of the blue. And then he said, okay, I mean, you investigate him. I feel it's tuberculosis. And we investigated him. And ladies and gentlemen, Dr. Mehra was 100% right. So he used to think of, and his message to all the residents used to be, think of the common conditions first, and then think of the other conditions. What is relevant to us, you should think that diagnosis. And he was an inspirational figure. My first interaction with him was when I joined when I was appearing for the entrance examination. I was more keen to become a general surgeon than an ENT surgeon. So I had gone to general surgery clinicals and did miserably badly. And then they were all waiting, Dr. Mehra and Dr. Maan were waiting for me, and there were 10 candidates who were called. There were 2 seats. And at 12 o'clock, because surgery, there were 40 candidates who were called for 7 seats, and Dr. Mehra and Dr. Maan were waiting. And when I came, sir looked at me. I thought, any other person would have been angry waiting, but he looked at me and said, young man, where were you? So I said, sir, I had gone for general surgery. Why? He said, you're interested in general surgery, so why have you come to ENT? I said, this is my second choice, sir. So have you worked in ENT before? I said, no. So he told Dr. Achal Gulati, who was the senior resident, and he said, take him to the spotters. And I knew only 5 out of 10 spotters, so must have got 5 marks out of 10. And then came back and he told Dr. Maan, Munde da clinical karo. So Dr. Maan, as very humorous, he asked me, have you seen the head mirror? I said, yes, sir. So, bole pehno. So there was a patient, and he came in front of me and said, okay, what's your fine? What do you see? And he wanted to see if I am closing the other eye, So the moment, my eye was not closed, he said, okay. And then I came to Dr. Mehra. And, he gave me a patient of CUP, carcinoma with unknown primary, and I just, jiska chha gaye bolte hain. And then I answered all my questions, and at the end of my examination, I knew that I'll be selected in ENT. But I was in dilemma because I had a house job in MCH in Nimhans, because I did very well there, but I had no experience. So the head of the department said, you do 1 year house job here, and then you try for the entrance examination. And I got ENT here, same hall, I paid 400 rupees, took a seat, and then went back to RML hospital where I was doing my house job. So there, my boss said, don't join ENT, they only do septoplasty and tonsillectomy, that's it. So I'll get you a 2 years PG in AMU. I went home, my dad said, a bird in hand is better than 2 in the bush, join ENT, whatever you're getting. So I came here, and rest is history. I don't regret having joined ENT and was in contact with Dr. Mehra for another 7 years, and I think he was worth emulating. Um, I'll just tributes to other Dronacharyas, Professor Mohan Kameshwaran, Professor Suresh Sharma, and Dr. Pandhi. All these people actually, believed in my ability, and that's how I carried on in the specialty. My gratitude to Dr. Mr. O.P. Sharda, the registrar of this institute. I'll not tell, later on in my other conversations, I'll tell you why I just really worship him. Because in one sentence, I am in PGI because of him. So, and late Professor I.C. Pathak, actually, I got a lot of his affection, and 2 days before his demise, I got a call from Grover ji, my personal secretary, says, "Sir wants to see you." So immediately I rushed from Caro Block. I came to the main NICU, the extension, NHE. Sir came and said, "Menu na thoda yaar ithe ulcer ho gaya tonsil de upar." 2 days before his demise, I saw him in my room. The moment he entered, he saw Dr. Mehra's photo and said, "Good, Yogi di photo badi changi lag rahi hai." So, and then I looked at him. There was an ulcer. I cauterized it, and then next day I completely forgot to ask his condition. Monday I finished one surgery. Suddenly remembered I should ask, "How is Dr. Pathak doing?" I rang him up and said, "Sir, how are you doing?" "Bilkul theek hai yaar. Tusi jo dawai lagai badi effective si ki." And that's it. And then we came to know on Tuesday morning that he was no more. So another person I really, I am a Eklavya for Dr. Kakkad, and the All India Institute of Medical Sciences honored me with the first Professor S.K. Kakkad Oration in August 2022, and that was a real privilege for me. I have fortunately, as a being in a long tenure as head of the department, I actually worked with 5 directors. And the one thing which Dr. Vivek just said, that they were the people who used to fight for the department. They were, when I went to Dr. B.N.S. Walia, sought his blessings, because when I joined as an assistant professor, he was the director. So he told me, "Very good, as head of the department, it's a thankless job. No one will appreciate your efforts. But at the same time, the welfare of the department is most important, and you must fight if you think it is right. So don't," and you just give a disclaimer that you're fighting for the department, not for any personal gains. And that's how I also tried doing during my tenure as head of the department. I passed on the mantle of the department to Dr. Jayamanti Bakshi and the other faculty members, and I'm grateful to say that that the services which Dr. Satyavati talked about, that we started, was all a combined effort of the faculty of the department, and my sincere thanks to all of them. Again, we have had illustrious alumni who have been holding very important positions, and I am grateful to many of our students and alumni who came during my superannuation on 30th June 2024. So what I would talk about is I'll just walk the memory lane in next 20 minutes. And this is one of my favorite slides, and I always preach it and practice it too. And that is that it's a team approach for effective management of the patients. This is a story of 2 geese and tortoise. 2 geese hold a stick, and they are flying, and suddenly they land up, and the tortoise says, "Can I hang up?" So they said, "Okay, you two can come join." Suddenly someone asked, "Whose great idea was that?" And tortoise said, "Mine," and he fell down. So this is how, if you want to walk fast, walk alone. If you wish to walk far, walk as a team. So my time as a resident, there were hardly any relaxing moments. This was in my room. And then PGI at that time, as it looked, there were very few cars, few Maruti 800s and Fiat. And then this is one of the moments where I received my degree from Professor P.L. Wahi. And this is Dr. Ombir Singh and Dr. Kunal Gangopadhyay, who is in, and they are cracking a joke with me, telling me you're looking smart. Then, journey of 1,000 miles begin with small steps. The first decade, 1990 and to 2000, as a faculty member, I attended many hands-on workshops, CMEs, practiced temporal bone dissection in the dissection room adjoining the doctor's duty room. There was no skill lab then. And in 1991, when Dr. Mehra retired, and one of my colleagues, Dr. Surinder, would remember that me and Dr. Satish Mehta, another friend of mine, and we wanted to do stapedectomy. And then we told, Dr. Surinder was the house surgeon, we told him arrange a microscope. We went to the autopsy room and practiced stapedectomy on each ear, me and Dr. Satish Mehta. I attended, Thomas Belcani was the one person, very celebrated otologist, and I attended his workshop in House Ear Institute, Mayo Clinic, there in 1999. And then my experience with Dr. A.J.D. Maran, whose picture you can see, and he was a versatile man, like he used to, where I used to stay, he used to come in his cycle, and then he'll knock on my door. I said, Naresh, how are you? And let's go. So 7:45, he will come, knock at my door, and then we used to walk to the ward. And then when I was appearing for the FRC's examination, I was short of experience by 6 months because they required 18 months of surgical experience. I had 12 months. So I wrote to him saying that, I sent him my logbook saying that I have done so many general, head neck procedures, and I may kindly be allowed to appear for the fellowship examination. So fortunately for me, he was the president of the Royal College of Surgeons then, and then the Royal College of Surgeons allowed me to appear, gave me an exemption of 6 months to appear for the fellowship examination. So various innovations we did. This was all the combined faculty effort. And then the journey for cochlear implant began in the year 2001. Dr. S.K. Sharma was the director then, and I was an acting HOD because Dr. Maan, my predecessor, had gone to the medical college. So by that time, 2001 it was, and Chennai, Mumbai, Delhi, they had done one cochlear implant, and I wanted to, put the PGI in the cochlear map of India. So I went to sir and told sir, we're already late. 3 cities have already started cochlear implant, so he was very keen. He said, why didn't we start earlier? I said, sir, I'll not like to go to the details why we couldn't start, but I want to start now. So cochlear implant journey, it was a leopard at the end of the tunnel. Even now there is a leopard at the end of the tunnel, because you never know when you would fall into a trap in cochlear implant surgery. So thank you very much, sir, for giving all the encouragement. And then in 2001 October, me and Dr. Anu Nagarkar went for a cochlear implant training in Bionic Ear Institute, Melbourne. It was a 15 days extensive training where we went there, and then this is a picture of the surgeons there were 4 surgeons from India and 4 from Korea and 1 from America. And then I met another close friend of mine who is now a celebrated cochlear implant surgeon, Rob Briggs. So not only a friend, he became a guide and a mentor. And he used to tell, when I was doing my first dissection for cochlear implant surgery, I exposed the facial nerve, and he came to me and said, Naresh, never expose the facial nerve. So that was stuck to me, and I've always, when we trained, 5 years before I was to superannuate, 4 surgeons in the department have been trained so that the cochlear implant services continue unhindered. So we did our first cochlear implant in 2003, and it was mentored by Dr. Mohan Kameshwaran, and Dr. Mehra was so happy. He said, I knew, Naresh, you will do it once. You will do the cochlear implant surgery. So everything was fine. And the 4th cochlear implant surgery, when we did, and after 1 month, there was a suppuration, and we had to do the explantation of this patient. It wasn't easy. It wasn't easy because that time we were the 4th institute to do cochlear implant surgery. People were not talking about complications, they were talking about numbers. And I was the one who was asked by my mentor, Dr. Mohan Kameshwaran, in 2004 to talk about complications. How did you manage your complication? So I was the first flag bearer in cochlear implant surgery to talk about complications, because none of the surgeons those days used to talk about cochlear implantation. And then, it was a quirk of destiny that in 2023, I was adjudged to deliver the most prestigious CG Oration in Chennai. So this was the CG Oration in 2023. And we also hosted the 8th annual conference of CGCon in Chandigarh in the year 2010. So as has been told by Professor Satyavati, so we did some classifications, round window classifications for easing the surgery. We also studied the degree of electrode insertions and outcome analysis, periosteal flap, because that's how they say that whenever there is a problem, this is the problems are the necessity for invention. And that's the thing when we devised a periosteal flap. And then came COVID, and then we devised how do we reduce aerosol production, which I'll be talking. So we graded the cochlear implant, this round window types, and this is type 1, where you can see the entire round window membrane. So you can see you will require just a minimal drilling to expose the scala tympani. So you just, it just takes few seconds and you open it. Then this type 2, where you see less than 50% of the round window, and then you have to do some drilling. In type 3, you have to do some more drilling to expose the scala tympani, and this we published. We did a validation study also with the Madras ENT Research Foundation. So depending on the grades which you're encountering, you may have to do more this drilling. So we also divided, this degree of insertion on, how does it impacts the outcome, and that also was done by one of the residents then, who is a faculty member in the department now. We also started with a large lazy incision, and then landed up giving a much smaller incision in children, and was appreciated by all. This is the periosteal flap, which we devised, and this is the periosteal, very easy curvilinear flap, which gives a wide exposure. And this incision, when you close the periosteum, it lies much posteriorly, and the skin incision lies anteriorly. So this is how various innovations was devised and then published also. COVID was a different ball game, and we came across, we were all disoriented, bewildered. The surgeries were not being done. We were all scared what is there. And then at that time, the CAM, the COVID-associated mucormycosis stuck. And I'm really grateful to the anesthesia department, and including Professor Puri, who was the head of the department then, who actually allowed us to operate 24 hours a day, and most of the anesthesia faculty members, senior residents, our senior residents used to do 4-hour shift, and we operated in a 2 months time 412 cases of mucormycosis. So that was really remarkable. And then we devised a novel way of reducing aerosol generation in otologic surgery. And that was the time when we did 18 cochlear implant surgeries, even during the peak of COVID. And this was one of the bilateral cochlear implantee. Sound. Can we have the sound, please?
Guria. Inaya.
Papa. Menu. Chocolate. Dedo, please.
So there were many trials, challenges, and tribulations, and this is one which I was talking about, our 4th case, and this is where a temporoparietal fascia flap. If I see Dr. Ramesh Sharma, who was, he was there with me all the time. We did not have any solution what to do when you have an exposed implant, and that came, his services, his help all the time. And then we devised temporoparietal fascia flap to cover the implant, do a debridement, and that's how these are the pictures where we are debriding an exposed cochlear implant, removing all the infected tissue, and doing a reimplantation. So this was very trying, but I'm really grateful to Dr. Ramesh Sharma. That time when he came in and with a suggestion to do a temporoparietal fascia flap cover. There were many other accidents. This was one of them, who had undergone 3 times surgery. and failed mastoid surgery. We diagnosed them as polyangiitis with granulomatosis, and then ultimately she was treated for vaginous, and then once treated, we did the cochlear implantation. And what has happened in this patient that we have gone into a false track. So it was gone through into the intermediators. We revised and did a second turn cochleostomy. So after doing a second turn cochleostomy, we removed the implant the very next day and did a second turn cochleostomy. You can see the free flow of CSF. So anytime when you are doing cochlear implantation and there is more than usual leak, think of that you are in a false passage. So this is how you can see we are doing the second turn cochleostomy here. And this is the patient.
आप अपने बारे में बताइए।
मेरा नाम अंदीप कौर है। मेरा कोक्लियर इम्प्लांट हुआ है। उसके बाद मेरी जिंदगी बदल गई। मैं पहले जब मैं बीमार हुई थी सुनाई देना बिल्कुल बंद थी। जिस दिन मुझे सुनाई।
So this is another 82-year-old patient.
कर रहा हूँ और बड़ी मुझे खुशी है कि मैं जिंदगी में वापस आ गया हूँ। मेरा बिजनेस है, मेरी फैक्ट्रीज हैं, मेरा काम है, मेरे बच्चे हैं।
He had all the comorbidities to make a cochlear implantation.
एक अच्छी गुजार रहा हूँ।
Not indicated. But his 7 children, but he was the man who said, I want to take a risk, go ahead. And we did the cochlear implantation for him. So this was emotions exemplified, the words of gratitude, worth, and this talks about my team, and it says, Aapki team bemisal hai. So exciting moments. This was one patient who had absent cochlea on one side and a cystic cochlea on the other side, which we call as CCVA. And you can see this child is now hearing normally and going to a normal school.
Hello Riya. Hello Riya.
Hello.
नमस्ते।
Very good.
आपका नाम क्या है?
मेरा नाम रिया है।
And
Hi,
this,
my name is Naya. मेरी मशीन लगी है। जब जब मैं 2 years की थी, अब मैं 8 years की हूँ। मैं सुनती हूँ, बोलती हूँ।
so Brett Lee came to promote cochlear implantation in this region, and we called him when he was doing commentary in the IPL here, and that was the time when Brett Lee said that even his own child was suffering from hearing loss. That went a long way in motivating some of the parents. We also started something called as gossip, not the real gossip, and group of cochlear implantees and parents, and I thank one of my colleagues, Dr. Anuradha, that she used to take very keen interest. We used to call, every 3 months, and those Saturdays were our best Saturdays for the cochlear implant team. This is one of the sessions. We did the first auditory brain implant in August 2022. And then we celebrated 2 decades of cochlear implantation on 6th of April 2024, where we heard the transforming stories of the children who were implanted. So too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, all of which have the potential to turn the life around. So good things come to those who believe, better things to those who are patient, and the best things to those who do not give up. So my thanks to and gratitude to all my friends, my residents, who are the backbone of the services in the department, the team, Cochlear Implant PGI, faculty of the department, and lastly, the parents of the lovely children who believed in our ability. We started other services also. Sleep apnea services were inaugurated by Mr. J.P. Nadda ji, and then you can see Professor Yogesh Chawla and Sandeep Bansal, and he's spearheading the sleep services in the department. We started allergy clinic, which is being carried on by Professor Satyavati Mohindra for the last 7 years now. The surgical skills workshop we have been holding regularly, and then in 2015, robotic surgery facilities came, and that Dr. Chawla would remember, there was only 8 training slots, and all the slots please don't mind, all the slots were taken up by the urology department. And I wanted to start robotic surgery in PJ. I went to sir. I told him, sir, there were only 8 training slots. All of them have been taken up by the, so what's your suggestion, sir? Asked me. I said, sir, we should have a meeting because the urology head of the department is little adamant. So he readily agreed. We had a meeting, and then he told us that we will write to Vatikuti to give 4 additional slots for training for 2 ENT surgeons and 2 gynecologists. So that's how me and my colleague, Dr. Ashok Gupta, went to Celebrations, Florida and UPenn for 10 days time, came back, started the robotic surgeries. And then we have done all oropharynx malignancies, robotic assisted thyroid surgery, tongue-based reduction, parapharyngeal space tumors, and lingual thyroid excision. And you will be happy to know that after Dr. Gupta and after I superannuated, these services are being done very efficiently by Professor Jayamanti Bakshi and Dr. Saurabh Patro, who trained in US and South Korea. And congratulations for taking the services forward. So this is one of the pictures for this thyroidectomy. This is one of the pictures. Last day on 28th of June, I had last robotic surgery which we did. This is the team who was there. We published also many of our work. This is one of the videos of robotic tonsillectomy. And we have been a part of changing face of surgery. Like in other spheres, the only constant thing is change. And we have seen it because we used to do commando operations for tonsillectomy, which is history now. And now what we are doing is a robotic radical tonsillectomy. So we also did, as you know, that I profess to learn and teach anatomy by practicing and not by preaching. And I must, give my appreciation, express my appreciation. It was a combined effort by me, Dr. Ramandeep Virk, our financial advisor, because that was the time when Dr. N.K. Mehra, he used to be the chairman, now also he's the chairman, and he had 1,000 objections. Why you are going for Karl Storz endoscopes? Why are you going Zeiss microscope? Why are you going for this? Why don't you do, because you have GEM. So, and our financial advisor, Kumar, Mr. Kumar, convinced. We had 2 days. I was called first day, second day again I was called, and he was able to tell, sir, this is going to be the first skill lab in the country with all the state-of-the-art facilities. And I congratulate Dr. Virk, who is again, taking it forward, and I'm sure, we'll expand it in future. So thanks to, again, this again a story on Nehru Hospital Extension, the OT complex. And in 2021, once the COVID was over, I was forced by Dr. Jagatram. He once called me. We used to go for Saturday rounds, me and Dr. Sandeep Bansal, and he used to say, "Shuru karo, jaldi, shuru karo." And I used to tell, sir, isko humne integration karna hai OTs ka, nahi to otherwise we are going to be here for 50 years at least, and we'll be again landing up with the same OTs which we have the 4th and 5th floor. So one day he called me. Manoj told me, sir, bula rahe hain aapko. Main gaya. He said, Doctor Sahab, shuru karna hai. So I said, sir, please try to understand, and it will be difficult. We have to do integration. And then I requested Dr. Vivek Lal. He took over as director, and then in June 22, Dr. Lal inaugurated our NHE, including the integrated OT complex, which is again a state-of-the-art operation theatre, not available in any other part of the country. Carotid body tumors and jugular paragangliomas, we used to do all this with Dr. Anand Mishra, for whom we used to always work as a team. And again, AV malformations, vascular malformation, I used to call Dr. Ramesh Sharma, and this was one patient. When we took the patient to the operation theatre, and I just made the incision, there was a huge flow of blood. Sir told me, Naresh, nahi karte isko aage. So we stopped, stitched it. And then after 2 years, he came with this, you can see a large tongue lesion. And then we excised that, and then later on, Dr. Ajay from neuroradiology department used to do embolization for this patient, who is still having a average quality of life. So the message is, if there is a mountain, you do not have to necessarily climb all the time. So this is the experience with then we did the thyroids. We have a very extensive experience in doing even monster goiters. Paragangliomas, we have a large series doing very extensive paragangliomas. This is one of the pictures where the facial nerve is being transposed anteriorly. Oral atresia was a challenge, and Dr. Mehra was the only surgeon in the country those days when we were residents to do oral atresia. It was his passion, and he will do only one case in a day. And he used to have, I have shared it with the residents, he used to have a battery driven drill, and which he used to give it to me, Naresh, isko drill, isko charge karke lana hai. So next day, I'll entire the night it will be charged, and then I'll bring it, and he will take his all sweet time to finish an atresia surgery and doing great work. Now my gratitude to Professor Madhu Khulla, and with whom I collaborated in the year 2001, and for almost 21 years we collaborated we did research on genetic mutations in hearing loss, congenital hearing loss. We did HPV studies, and this is the team. Here Anupam, and this is one Rajni Sharma, who has done a very pioneering work in HPV. In 2016, we were lucky, we were given permission to appoint one assistant professor in research, and we had Maryada Sharma, who is doing a great work in precision medicine approach in auditory regeneration, and she's got innovation award, and this is actually a prototype to generate neurovascular organoids and from autologous blood. I will not go further, but I think when the results come, I'm sure we'll all be really be proud of her work. So there are some new frontiers for the future, and something like near infrared spectroscopy is in vogue now, and I'm sure in future department will look into the outcome analysis of cochlear implants using the NIRS. So this is if this works, this is oh, it's not working anyway. So for future, we have what is called as a robotic cochlear implant, and that is called as HERO, hearing by a robo, and that's how it's the future. And I'm sure in coming years, as sir had told me that we want cochlear implant services in the department, and I'm sure the cochlear implant surgeons of the department today will go and do and get robotic robotic cochlear implantation running in the institute. So my sincere acknowledgements to all the people who have worked with me, Dr. Jerry John, and then Dr. Ramesh Sharma. I have operated as a team with Dr. Kaman for hypopharyngeal malignancies. We used to do very extensive gastric pull-up surgeries with him, and then with the advent of the organ preservation protocols, the cases came down. So grateful to all of my colleagues, including Dr. Sushmita, Dr. Anand Mishra, Dr. Jerry, Dr. Gaba, Chirag, Paramjeet, Dr. Ashim Das, Amarjeet, Dr. Amanjeet, Dr. Aman Sharma, Dr. Arunalok Chakravarti, Shiva Prakash, and many others with whom we collaborated for the welfare of the patients. Gratitude for my family for all the support. Though though Dr. Nidhi always would crib for my long hours in PGI, but I used to take it in my stride. Thank you very much, ma'am, for all your support, your blessings and affection, and I always savor this relationship and your affection all the time. We are all reaping. This is a collage which shows that we are all reaping the fruits of the dream of Dr. Mayan Mehra at the time when the department was established. I have learned that everyone wants to live on the top of the mountain, but all the happiness and growth occurs while you're climbing it. And there are a lot of young surgeons, and I always say, I have been saying, and that is that there is no elevator to success. You have to take the stairs, so keep climbing through the stairs for your success. Thank you very much, ladies and gentlemen, for your kind words.
Thank you, sir, for this beautiful oration and journey down memory lane. It was an eye opener for all of us, and many of us who did not do or did not get a chance to do our MS at PGI. Thank you so much. I would call upon Dr. Bansal, Dr. Anurag for the felicitation. So we will have the memento presentation by Dr. Lal sir. For the scroll presentation, Dr. Saurabh, Dr. Satya, Dr. Jaya. Dr. Rathod sir to present the scroll to Professor Naresh Panda. Thank you, sir. Now I invite Professor Rathod, Dean Academics, to deliver the vote of thanks.
Good afternoon. I'm honored to I'm honored to propose the vote of thanks, the most pleasant work of the ceremony. So on this occasion of this 16th prestigious Mehra Oration. First of all, our thanks to our esteemed director, Professor Vivek Lal, for his constant support, his motivation, and always attitude towards everything, whatever you want from him. It is my privilege to extend my gratitude to Professor Naresh Panda, the former head ENT, Otolaryngology and head and neck surgery, as well as the former Dean Academic of the PGI, for accepting our request to deliver this prestigious Mehra Oration. Sir, it is to express our feeling you have mesmerized today. The whole hall was astonished by looking into your 4 decades long journey in the PGI itself. This is a remarkable moment, and I think it will be an example for everybody who are here, who are not here, who will be hearing about it. And also it is a motivation for the department to grow further. You have opened up all the channels, and everybody has got every chance to grow under your guidance. I hope that you will be supporting to the department whenever it is required. One thing I always I experience the timeliness in your activity. For any time, anywhere, any work required, even the OPD, whenever you take consultation, if I get 10 minutes late, he will show his face. He will say, "Is it time to come?" So that I always remembered it, and it is nice. Whenever we were going to Delhi, the car was waiting outside. Just 5 minutes, he called, "I'm waiting outside." So that is the thing what we really learn from you people. In the cochlear implant program, what you have shown is, it appears to be one of the most important and earliest programs established in India. So the credit goes to you, and I will request the audience to have a loud applause to Professor Panda for his achievements. See, you have made so many milestones. To share, just as a colleague, Professor Naresh Panda, he happened to be 2 years ahead of me in almost many spheres. He's born 2 years ahead of me in MBBS course in the same college. then MD in the same institute, and even the deanship. So this is the thing what we said. That's nice to it. So thank you very much for to be here, and we are really enjoying your presence. And we don't feel you have gone out. You are still a very close member of PGI, and we will always expect that. I extend my sincere thanks to the former directors. We have so many directors today, so see, and we really feel happy. Professor S.K. Sharma, Professor Chawla, we have former deans, then we have Professor Suri, Mrs. Suri, then Dr. Sanjay Jain, and we have former professors, HODs, faculty members, staff, students. I'm really thankful to all of you because you have participated in the program and made this program a great success. Our sincere thanks to the family members of Professor Y.N. Mehra, more especially ma'am, Mrs. Mehra, for kindly be present here, and also you have agreed to establish such a prestigious award in our institute as a Oration. So each year we remember you. Thank you very much to be here with you. I congratulate the Department of Otolaryngology. I always say Otorhinolaryngology. I don't know why rhino has missed it. So Otolaryngology and head and neck surgery, the faculty, staff, students, and the organizing such an important function in this institute. And it is recurring. That's more important that each year we are having this function. And I remember last time Professor Naresh Panda was here to tell about the orator, and I was giving a vote of thanks as a sub-dean, and today I am giving as a dean. So it is nice. I am enjoying this pleasure. Thank you very much being here, and thank you very much. Jai Hind.
Thank you, everyone. With this, we come to the conclusion of this oration, and I invite everyone for tea downstairs. Thank you.